Hello everyone, I am Dr. Varsha, fertility consultant, GarbhaGudi IVF Centre, Bangalore. Today we will know about PCOD or PCOS. This is like Polycystic Ovarian Syndrome or Polycystic Ovarian Disease. Here, nowadays PCOD has become very common problem. Approximately about 5 to 20% of the female population in their reproductive age period suffer from PCOD. So this is usually caused by a multifactorial disorder. It is usually genetic related. In your family, if mother was suffering, aunt, mother, sister are suffering from PCOD, then you are also more prone for the PCOD. And we also call PCOD as a lifestyle disorder because of the sedentary lifestyle, lack of exercises, bad dietary habits like eating too much of junk food, sweets, oily food. This has become more common nowadays. So usually PCOS patients, how they present? Usually they present with irregular menstrual cycles, then infertility, or they might present with hirsutism or androgen excess, presence of excessive hair growth on the face, pigmentation on the back of the neck, and hair loss or too much pimples on the face. These are the androgen excess features in the PCOD. So, when to consult a fertility consultant or the doctor gynecologist in a PCOD cases? If you are suffering for irregular menses, if you are having the features of excess androgen in the body, or if you are suffering from infertility, then you have to consult your doctor. Then, what are the usually tests done in PCOS? Usually, we will do hormone test on day 2 or day 3, FSH, LH and their ratio, and fasting insulin and postprandial insulins. What are the male hormone levels in the female like DHEA and testosterone, and other hormones like TSH and prolactin. Not all tests are required in all PCOS cases. Depending on their symptoms and their case profile, we will advise whatever is required. So what next comes, how we will treat the PCOS patients. It all depends on whether the patient is married or not. If they are married, they are willing for the conception or not. If the patient is not married, if they are not planning for the pregnancy, then we will put the patient on oral contraceptive pills, which will regularize the menses, and it will also do the hormonal correction of hormonal imbalances in the body. So, and next is metformin. Usually PCOS patients will suffer from insulin resistance. So we will be adding the minoxidils and the metformins. And if the excessive hair growth is there on the face and face, chin and all, then we will be advising for a laser treatment or electrolysis treatment for the permanent hair removal. And if the patient is planning for the pregnancy, we will be doing the fertility treatment. If the semen parameters are okay, tubes are open, we will advise the patient for either ovulation induction and timed intercourse or IUI procedures. If any other associated conditions are there abnormal semen parameters or tube blockage, or in spite of the multiple OITI cycle, patient is not conceiving, not ovulating, then we will be recommending a IVF treatment for PCOS patients. Thank you.